Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share this week's update on the COVID-19 pandemic. This is for June 7th, 2020. As you know, this pandemic is affecting virtually every country in the world, and we started to see a significant increase in the number of deaths worldwide in mid to late March. And we began these reports a couple of weeks later in mid-April, at which time there had been 165,000 deaths in the world. We followed that number every week, such that by this week there's over 400,000 deaths in the world and about 7 million confirmed cases. Though as I've said before, I don't follow the number of confirmed cases because that is reflecting pretty much how much testing is being done and not necessarily how much disease is out there. But deaths are pretty reliable, so 400,000 deaths is sort of where we are today. If you look at the US, the pandemic began here a little bit later, and so by mid-April we had about 45,000 deaths. We've been following that every week. Last week we passed 100,000, and this week we're at 112,000 with almost 2 million confirmed cases. To get a sense of the magnitude, I like to follow a particular statistic, and that is deaths per million, because that tells you how much the pandemic is affecting any given country. When we began these reports, there was considerable variation between countries in the number of deaths per million. The US had about 123 deaths per million compared to Belgium, which was the most impacted large country in Europe with about 4 times as many. We followed that every week and seen consistent growth across all countries, such that the US is now 339, and Belgium is 828. Belgium's seen a 65% increase in that time period. We've almost tripled in that time period. But I want to call attention to something else, and that is, I made a statement last week that the pandemic appears to be slowing down, at least in European countries and in the United States. And this is the US over that 7-week period. And the reason I say it's slowing down is in the first week, we saw a 26% increase in the number of deaths. In other words, the number of deaths plus a quarter. By the next week, the same the week after that. But then it began to slow down. We saw 16%, 12%, 9.5%. And over the last week, we've seen a 7% increase. So it does look like the epidemic is slowing down in the European countries and in the United States. But we have to be really careful about how we interpret that. Because remember, last week I showed you the top 25 most impacted countries in the world and how we were now seeing some of the countries in South America appearing. Just over the last week, we've seen a significant increase in those countries, such that the 4 most impacted South American countries grew an average of 19% just over the last week, sort of similar to where the US was about 6 or 7 weeks ago. During that same time period, the 4 most heavily impacted European countries grew about 2%. So while we may see the pandemic slowing down in the US and in those European countries, if it's growing anywhere, a pandemic anywhere is a pandemic everywhere. So we do have to continue to watch what's happening in other countries and in our own country. It's still an evolving pandemic. Even if it may be slowing down, we don't know what's going to happen when we move away from strict social isolation and when we start going back towards normal. There's a lot of information about COVID-19 on our college website. If you go to www.etsu.edu/cph and hit this icon there, it'll take you to a lot of these short videos. And also, if you have any questions or any topics you'd like me to address, please don't hesitate to let me know. I can be reached at that email address below. Thanks a lot. Bye-bye.